We all sweat. It's a natural bodily function. Sweat helps regulate our temperature, but for some, sweating goes beyond a normal bodily function. It becomes a burden. This is hyperhidrosis. Hyperhidrosis is a medical condition. It causes excessive sweating. This isn't just getting a little warm, it's debilitating sweat. It impacts daily life. It affects work, relationships, and self-esteem. Hyperhidrosis is more than just a physical condition. It carries an emotional weight. The constant worry of visible sweat can lead to anxiety and social isolation, but there is hope. Understanding hyperhidrosis is the first step to managing it. Hyperhidrosis is excessive sweating. This sweating is beyond what's needed for normal body temperature. It happens even when the body doesn't need to cool down. This can happen at rest. It can happen in cool temperatures. It can even happen randomly. There are two main types of hyperhidrosis. Primary focal hyperhidrosis is the most common. It usually begins before age 25. It often affects specific areas. These areas include the armpits, hands, feet, and face. Secondary generalized hyperhidrosis is less common. It's caused by an underlying medical condition. These conditions include diabetes, thyroid problems, or certain medications. The main symptom of hyperhidrosis is obvious. It's excessive sweating. This goes beyond dampness. We're talking soaking wet clothes, sweat dripping from hands. This can lead to other problems. These include skin irritation, body odor, and even infections. The emotional impact is significant. Imagine the embarrassment of constantly sweaty palms, or avoiding social situations for fear of visible sweat stains. This can lead to social anxiety and isolation. It's crucial to remember that hyperhidrosis is a medical condition. It's not a sign of poor hygiene. Hyperhidrosis can affect any area with sweat glands. However, some areas are more commonly affected. The palms of the hands are a prime example. Sweaty palms can make everyday tasks difficult. Shaking hands becomes an ordeal. Using a phone or typing becomes a challenge. The soles of the feet are another common sight. This can lead to sweaty, slippery feet. It can make walking uncomfortable and even dangerous. The armpits are another area prone to excessive sweating. This can lead to embarrassing sweat stains on clothing. It can also contribute to body odor. The face is another area that can be affected. Sweating on the forehead, upper lip, or scalp can be socially awkward. Section 5. Unraveling the mystery causes and triggers. The exact cause of primary hyperhidrosis is unknown. However, it's thought to be related to an overactive nervous system. This system controls sweat production. Certain triggers can worsen sweating. Stress, anxiety, heat, and spicy foods can all play a role. Secondary hyperhidrosis has a clearer cause. It's triggered by an underlying medical condition. These conditions include thyroid problems, diabetes, and menopause. Certain medications can also cause excessive sweating. These include antidepressants and some blood pressure medications. Section 6. Seeking answers. Diagnosis and evaluation. Diagnosing hyperhidrosis starts with a visit to your doctor. They'll ask about your medical history and want to know about your symptoms. A physical exam will be performed, which may include a sweat test. The sweat test involves applying a powder to the skin. This powder changes color when it comes into contact with sweat, helping to determine the areas of excessive sweating. Your doctor may also recommend blood tests to rule out any underlying medical conditions. Section 7. Navigating treatment. Finding relief from excessive sweating. Treatment for hyperhidrosis depends on the severity and the location of the sweating. For mild cases, over-the-counter antiperspirants containing aluminum chloride may suffice. This blocks sweat ducts. For more severe cases, your doctor may recommend prescription-strength antiperspirants. Oral medications such as anticholinergics can also be helpful as they block nerve signals that stimulate sweat glands. Botox injections are another option, as Botox blocks the nerve signals that activate sweat glands. Section 8. Living with hyperhidrosis. Managing the impact. Living with hyperhidrosis can be challenging, but it's manageable. There are things you can do to minimize the impact on your life. Choose breathable clothing like cotton and linen, and avoid tight-fitting clothes that can trap sweat and make symptoms worse. Carry a small towel or handkerchief with you to wipe away sweat. Managing stress is also important, as stress is a common trigger for hyperhidrosis. Practice relaxation techniques such as deep breathing or meditation. Section 9. Conclusion. Taking control and seeking support. Hyperhidrosis can be a challenging condition and it can affect your quality of life. But remember, you're not alone. Millions of people around the world live with this condition. With the right treatment and management strategies, you can take control of your sweating and live a full and active life. If you're struggling with excessive sweating, don't hesitate to seek medical advice. Talk to your doctor. They can help you understand your options and find the best treatment plan for your needs.